Assalamu alaikum. Hello, dear doctors. Good day to all of you. Today, I'd like to share a brief discussion about elbow joint, which is important for both part of MRCS examination. Now, I'm going to share the diagram of elbow joint. Here's find the diagram of elbow joints. Known to all of you that the elbow joint is the large synovial joint edge of the hinge variety of joint. The bones of the forearm articulates here's the bones of the forearm articulates with the lower end of the humerus. The upper end of radius and ulnar are bound together by the annular ligament of the radius in such a way as to permit movement between these two bones at what is described as the proximal radioulnar joint. The elbow and proximal radioulnar joints have a common fibrous capsule and synovial cavity, and though the annular ligament plays a part in the structure of both joints, it is described with the proximal radioulnar joint. Here's the articular surfaces or humeral articular surface at the elbow, which comprises the groped trochlea, the spheroidal capitulum, and the sulcus between them. This composite surface is covered by a layer of articular cartilage. The capitulum is confined to the anterior and distal aspects of the bone, but the trochlea extends round the distal end of the bone from the lower edge of the coronate fossa on the front of the humerus to the lower edge of the olecranon fossa posteriorly. The articular surface covering the ulnar surface of the elbow joint is interrupted along the deepest part in the transverse line. The trochlear nose articulates with the trochlea of the humerus, forming a saddle-shaped joint with it. The radial surface has a slight concavity. Here's the radial surface has a slight concavity to the proximal surface of the head, which articulates with the capitulum, while its rest margin lies on the capitulotrochlear groove. This surface of the head is covered with articular cartilage, which is continuous with the round the sides in the radioulnar joint. The radial and ulnar surface are most fully in contact with the corresponding humeral surface when the forearm is in a position midway between full pronation and supination, and the elbow is fixed to a right angle. The fibrous capsule, here's the joint, is encased with a fibrous capsule that is relatively weak and anteriorly and posteriorly. It's strengthened at the sides to form the radial and ulnar collateral ligaments. The anterior part of the capsule is attached to the front of the humerus, immediately superior to the radial and coronate fossa, to the anterior border of the coronate process of the ulna, and to the anterior part of the annular ligament of the radius. The brachialis muscle covers the greater part of the front of the capsule, and some of its deepest deep fibers insert into the capsule. The posterior part of the capsule is very weak in its median part. However, the tendon of triceps inserts at this site and supports it and also draws it upwards in extension. The radial collateral ligament is a strong triangular shaped thickening of the fibrous capsule. Its apex is attached superiorly to the anteroinferior aspect of the lateral epicondyle of the humerus in close relation to the common extensor muscles, which common origin overlies this site. Distally, the broad base of ligament blends with the annular ligament of the radius and is attached both in front and behind to the margins of the radial notch of the ulna. The ulnar collateral ligament is comprised of three capsular condensations which are continuous with one another, An anterior band passes from the front of the medial epicondyle of the humerus to the medial edge of the conoid process of the ulna. It is closely related to the common origin of the superficial flexor muscles. A posterior band is attached above to the back of the medial epicondyle and below the medial edge of the olecranon. A transverse band stretches between the attachment of the anterior and posterior bands on the conoid process and the olecranon. The lower edge of this transverse ligament is free. A small amount of synovial membrane may produce through the space between this and the underlying bone. The synovial membrane has the attachment of the synovial membrane generally follow those of the fibrous capsule. Nerve supply of elbow joints is supplied by musculocutaneous median radial and ulnar nerves. Movements include shifts occurs around a transverse axis, a movement of flexion when the forearm makes anteriorly, a diminishing angle with the upper arm, and extension when the opposite occurs. The axis of movements passes through the humeral epicondyles and is not a right angles with either the humerus or bones of the forearm. In full extension with the forearm supinated, the arm and forearm form an angle which is more than 180 degrees. The extent to which this angle is exceeded is termed the carrying angle. The carrying angle is masked when the forearm is pointed. I think now I've got a brief discussion about elbow joint. Thank you doctors for watching my videos.